So thank you very much for inviting me today. And I asked to speak about a project that has been successfully funded by the very early calls of RfSC. So I will try to give you some perspective of us as a researchers when we were writing and developing this proposal, and also a little bit about the project itself. So just to acknowledge that this is funded, and just to say that this is funded by under the RfPB. At that time it wasn't RfSC, and also to say that this is a collective effort, the presentation collective effort of my research team. So this is our team. So I lead this project, and I work with my colleagues Anne-Marie Towers, Naji Brooks, Sinead, and Barbara from the PSSRU and CHSS at the University of Kent. I want just to start about the thinking around this. So I'll go back quickly to tell you the title. So we are focusing on developing a scale for work-related quality of life for adult social care staff. And we want to add this to this suite of scales under the ASCOT, and we hope to develop a new tool called ASCOT Staff. And this project is just the first stage to determine the domains of this scale. So our thinking process is first to identify the theme and to link it to the call. So there was a specific mention of social care practice and the workforce. That was our kind of starting point. And then we had all the time in our application, our thinking to refer back to the core aim of the whole RfSC, which is what is in it for patient and service users. So though that we're talking about staff and the workforce and the quality of life at work, we had to link this back to the service users and the implications on the quality of care. And so it's really important to connect this in relation to the organization and delivery of care. And from the very beginning, also, we appreciate the very important role of the public involvement. And who are they? So who are they in our situation? So we know that people using the service, but also people organizing the services and delivering the care. So the workforce was important to be part of that public involvement. And we actively involved them from the very beginning, from putting together the idea and through writing up the first stage and second stage. And then, as like me, just is the research qualities, the team, the management, and also the quality of the methodology and quality assurance mechanisms, and the role of the project advisory group. So this is our advisory group. So we actually had a very good take-up of people from different groups and organizations, both nationally and internationally, and that showed actually this piece of work is really important. It resonates with many stakeholders. So we have from the UK, from England, People Skills for Care, from Unison, from different care associations, but also we draw from international partners who are doing similar research, like Thibaut Kroger from Finland, and Alistair McGregor from here, and I think we have also Sarah Charlesworth from Australia, who's done a lot of work. And also kind of after we in the second stage, we also wanted to include part of health and PPI. We've got two kind of stakeholders as part of our stakeholders and quality assurance of the whole process of the project. So we made it also clear in our terms of reference and from the very beginning of involvement, what the types of involvement of PPI in this research. And obviously we had some meetings face-to-face when we used to have face-to-face meetings, but now we will be doing the next advisory group virtually as everything else, but also in between we said that we can connect them by phone if we needed anything, or emails. They will be involved in developing study documents and provide feedback on the research findings. And we also, in our dissemination plan, we made it clear that they will support us to write both the lay summaries but also research findings for dissemination, and we have in mind things like blogs or kind of easy read versions of whatever findings we're going to get. just go back to the project overview to I hope that would be helpful. So basically we are focused on understanding the work-related quality of life, and we made it clear why this is important. So it's really important on the individual, the worker, the emotional and physical well-being, but also at the work outcomes. So the usual work outcomes like turnover, vacancy, the productivity, but in the context of social care, it is really, really important in terms of the quality of service provided and outcomes related to service users. And also we made the case more specifically about care and why we need to have something specific to social care. And we provide information like why they're particularly vulnerable to low levels of work-related quality of life, the caring being emotionally taxing. There are structural pressures in the sector. We know the low wages and increased fragmentation of work and lack of support because, for example, home care workers and domiciliary care workers, that they do the work alone. They don't have this co-worker support, which is really important both practically and theoretically in reducing burnout and stress. And also the issue of moral distress, which is something maybe very well related to care, where you are faced with different decisions that maybe they are opposing decisions, but at this, and both of them could feel moral, but they are very difficult to make. One example, for example, if it's snowing and in a care home, are you going to get people out to the garden and enjoying the snow, or what about risk assessment and other things around challenging behavior, dementia, and medications? Are you going to force medication, things like that? And we made it clear that we are aware of existing scales that focusing on specific things, and then we kind of distinguished what the scale that we're going to develop to be different from the other ones. So for example, the majority of scales look at wages, patterns of work, but ignore the emotional rewards from caring. And this is one of the elements that, although it is stressful, but it's very emotionally rewarding, and this is what we hear a lot from the care worker. And also, most of these scales do not really examine the impact of co-workers on the co-workers' own quality of life, but rather on bigger organization kind of measures and indicators. And also, we situated our work in a similar measure that exists, which is Ask Good Carers, which is looking at the informal care experience of caring for someone who is receiving social care in their own quality of life. And obviously, we expect Asked staff to be different from the Asked Carer because of the job of it, that they're not doing this just to as their own kind of activity, but it's a job, it's an employment. And then we had to be clear what is the expectation from this project and its aims and objectives. And we made it clear, we divided the kind of time frame of developing such a scale, and we concentrated on the first stage, which is engaging with different stakeholders, collecting data to formulate what would be the domains. It is the first stage to determine the domains of this measure relevant specifically to care staff. And then what is it? What is social care work-related quality of life? That it is the aspect of quality of life that are most affected by care work rather than general quality of life. And we expect these to be sensitive to working conditions and culture, but also understand that there will be negative and positive outcomes. And in this, it's more about the outcome rather than the process, because there might be a lot of ways to create a positive workplace or culture, but the measure aims to reflect how these working conditions impact on the care workers' quality of life. So we had 3 clear research questions, and we started by, we have to review and appraise the current scales that could be relevant to social care. So we have conducted an extensive review, but also tried to focus more on those that deal with care work, whether it's social care or nursing. And then identify the key domains that will be working with what's in the literature, but that's not alone. Of course, there are qualitative elements to the project and consensus element as well to reach a kind of agreement of domains. And through this, because we will be doing a lot of interviews and focus groups, we thought that we will identify at work support mechanisms that are likely to improve the quality of life of care staff. So that would be something that we could give back to the sector even prior to the completion of the whole development of the scale, but towards the end of this piece of work. So our methods were a scoping review, a systematic scoping review, group discussions and individual interviews with different stakeholders, and then a survey, a consensus survey at the end to decide on the domain. Obviously, we are all hit with COVID, and I thought that would be a good juncture to also tell you and be aware, maybe share with you the experience of what we have learned from COVID. It had been a time where we were just about to start our field work. So we had a lot of focus groups and interviews scheduled in March. And obviously with everything, we had to pause everything, and we had to come up with some ways to keep people interested in the work and to keep them informed of what's happening, and also to shift our timeline of work to try to do the things that we can do in our own first, while maintaining the work that we want to do. So we've added an additional element. We decided that the scoping review protocol we will be submitted, and that has been submitted. We have made progress in the writing up of the systematic review. We maintained our communications with our stakeholders and kept them interested. And we requested a 6-month extension, which is pending at the moment. I'm not going to go through this, but you will have the slides. So these are specific research questions for scoping review. And this is more details of how the Prisma flow diagram of the number of records we had to retrieve, and then at the end, which studies that we decided to include in the qualitative synthesis of themes. And then the primary findings of the review, that obviously, as maybe one expected, there are 3 levels where quality of life at work is affected within the care sectors, and these to do with organizational culture, job characteristics, and personal characteristics. And job involvement, I would highlight, is really important in terms of care worker. Now to the focus groups. So as I said, we had to shift these to virtual focus groups. So I put a little bit of a in the corner, right-hand corner, we were supposed to sit down and talk, and we had to change to virtual. And that I've got a few things to say about that. But in general, the reasons or the aims of the focus groups is to ask how working in social care impacts care workers' life, and more specifically, what aspects of their work help people to feel positive about their lives, and what aspects have a negative impact on their lives. The original plan is that we will conduct 2 focus groups with managers and 4 with frontline staff. To date, we have conducted 2 with manager, 1 with frontline staff, and due to the virtual nature of the meetings now and focus groups, and the nature of the care workers and frontline staff work, we found it really difficult to engage 4 or 5 people at the same time. They don't have time kind of to find time that fits everybody. They keep coming in and out of the call. So we've made a decision to replace the remaining focus groups with frontline staff with interviews. And obviously, it's going to be slightly different. The dynamics of the discussion is going to be different. The number of participants would be different, because the amount of time we would put with interviews will be much more, and we're reviewing this all the time and looking at the profile and characteristics of participants to ensure that we've got input from as a diverse group as possible, because we want to come up with domains that are relevant to people working in different settings, and with different groups of older adults and older people, service users who are using social care. So the reason, the purpose of the individual interviews is slightly different. It's more top-down perspective. So we are talking to stakeholders and people who maybe can provide a broader the vision of how social care is organized and how different elements of the organization and delivery can impact on the quality of life at work for care workers, and also to reflect. So we go with a list of kind of initial outcome domains identified so far, and then really kind of another aspect is to explore how the sector as a whole might use data like this and might use a scale like that, and what are the pros and cons, and how we can formulate it in a way that is most helpful. And in addition to that, to look at if there are certain organization support mechanisms to address staff work related to quality of life that that we can draw as a practical example that we can collate for our guide at the end. So the individual interviews, we have completed 12 semi-structured interviews. That is more than what we anticipated on telephone or on Teams. Obviously, we couldn't sit one-to-one and talk, but I think with that group of participants, this worked really well. So that was very good, you know, we were happy with the results and quality of data that we've come up. Participants included representatives from carer and care organizations, policymakers, and other relevant stakeholders. And what we did, that interviews and focus groups transcribed and are going to be analyzed using thematic analysis. We've done initial readings and we've come up with initial kind of themes, but this will be kind of done further in-depth analysis on that. So the initial findings from the individual interviews so far has been quite interesting. So the key points around three main areas. So the perception of the tool, requirements for the tool, what does it need to be, and benefits, how could it be helpful. So I think the perception of the tool, what we got, that it was very important for people to know how the data will be used once we collect this information. And people felt that this really needs to be viewed as a helpful resource rather than a stick to beat with. So what are you going to use this measure for? Of course, all of them said it would be really good to have a standardized tool for social care. So we are measuring almost the same thing everywhere, but the how that's going to be used by different organizations is really important, and I think that is a very, very important point. And the requirement for the tool, obviously, the time cannot be more challenging in terms of Brexit, COVID, changes happening in social care at a very fast pace. In terms of the skill mix, in terms of what people do, and they felt that the tool has to be sensitive to change and adopted into or supported by national framework or policy. And this is our hope, really, that it becomes a part of the ASCA tool, that it is collected at an kind of local authority levels, etc. And also and consider how to make changes rather than just measure. So that is, okay, we measure this, and then the sector wanted some helpful advice. Okay, how can we make changes? And I think if the domains are accurate to capture which elements have the more negative impact, then we can say in confidence that actually, you know what, it is the lack of support. You need to create new ways, or maybe it's working patterns, or maybe the feedback. You're not giving enough feedback to tell them that their job was done good enough, and things like that. And again, this is to resonate what the kind of the discussion that they felt is going to be very beneficial, because it will identify areas for development, and everybody appreciated that good work environment means good quality of care. So we are talking about return to service users, and also returns to the whole kind of sector in terms of preventing staff burnout, and also forging a better relationship between workforce and management, and other kind of outcomes like vacancy and kind of retaining staff for longer. So our next steps, once we completed the remaining now interviews with frontline staff, we will conduct a survey after kind of collating all the information coming from the different sources, we will come up with a set of domains that we want to find a consensus. The participants in the surveys will be everyone participated in the research, and we made the decision in our methodology and from early on that we have to close it on this group, because this is the group who have been involved and discussed the matters. And if we get somebody new at that stage, they might be coming from a different angle, and we will not going to reach a consensus. And it's the specific, we will be looking for specific feedback on the importance and priority of the domains identified through the previous stages, both the scoping review and the qualitative stage. And as I said, this is where the participant will come from. The survey is designed to take part online survey, but we appreciate that some care workers and some care users we might find it difficult to complete. So we will have the option to complete it by phone call. One of our researchers will be in touch and go through all the questions with them. So these are just some ideas so far. We're coming up with examples of what are the domains, and these are based on the review of literature, but also the initial discussions. And what you can see here, there are things that are maybe intersects with any other job, like feeling valued and supported, that job enables you to meet your own needs, because it's kind of you work to have financial rewards or other rewards. But there are other specific things that maybe it's related to the care work, which is the relationship with users and carers, having time to meet people's needs, because a lot of the motivations of people to join the sector are altruistic in nature, and they want to make a difference. And what we found again is like the ability to make decisions, which is linked to the quality of life, the quality of work that you're doing. And another element specific to maybe the sector and maybe other sectors is feeling safe at work. So it's a general element, but maybe it is more specific. You're dealing with people with challenging behavior, or there are conflicts, etc., etc. And also feeling safe with management, that if you made a decision that would not kind of make things problematic, if you can kind of justify and talk through the process of decision making. So our plan for dissemination and outputs, so the core of the work is really to come up with a set of agreed domains of asked stuff that we can build upon in the next stage. We will come up with a brief guide for social care practitioners and employers of what works, what are the things that already exist, that can people draw on and share good examples. There will be a summary report to be published on our website, and 2 peer-reviewed articles, and we're hoping to make these open access, and also some blogs that will be jointly written by the team with the PPI involved, in the project. We have a project website, and we decided not to have a hashtag for the project, but to have decided not to have an @ which is a name for the project, but a hashtag, so we can kind of try to see the communication going there. In our application, we made it clear that the impact for this research is a bit longer term, because okay, it's really important to find the domains, but then to make it really impactful, we need to pre-test and make cognitive interview and pilot, and then validate, and then that would be a tool that could then be adapted and used hopefully nationally. So this is our kind of longer term plan, and that the project that is funded at the moment is looking at phase 1, and this is why we said phase 1 in the title. And we are now in discussion of thinking around how we're going to bring more funding to start phase 2 and hopefully phase 3. And we have, we're thinking about different options, including hopefully if we can put an application for the next round, but we haven't made the decision yet. And the short-term plans, which is really important because there are lots of low-hanging fruits, and it's really about making this, discussing these issues and, talking about it, and also kind of share the information with different groups. So we have been invited through another project to contribute to the labor market enforcement strategy. So we could bring these issues, we can talk about working conditions, we can contribute to different kind of consultancy and APPG groups consultancy, and we did contribute to a recent consultancy around burnout, staff burnout, health and care staff burnout. So there will be some low-hanging fruits, and it's really important to highlight this in your application, that there are benefits short-term, even if your project needs a kind of continuation to bring in something specific, like in our case, this tool that is validated and tested with a large number of participant tool. So basically, just to sum up, is few key criteria when you're developing an application. And I'm talking here from perspective of someone who had a lot of rejected applications as well as successful applications. So don't take it hard if it's rejected. It just happens, and maybe it's too ambitious, maybe it's there's something in the methodology or the team, or it's not the right time for it. But it just, in that case, when it was successful, I think these were the key criteria from my point of view. The relevance of the topic to the funder and the program aims, the team, particularly the PI, and I would encourage early career researchers to go for a PI, but to make sure that there is a senior researcher in the team to support this process, and we have done that successfully in other projects. But the collective of the group is well situated with enough expertise to undertake research in this area and with that specific methodology, and that would bring us to the research design and the methodology sound also very relevant to the research question. The feasibility of the project activity within the time frame, and I think as if it's Laimi and myself were just discussed the slides before, but we haven't because it makes sense, and also being very clearly aware of potential risks and mitigating factors. And we have been put on the ultimate test with the COVID-19, and we came up with ideas, and you have to be resilient and try to adapt to the change. But from the very beginning, there are always things that you can foresee. There will be risk that I can't do this or can't do that. And it's very important to spell this out in your application and say, what are you going to do then if that happens? So you're mitigating, kind of strategy. And the tangible outcomes. As I said, you have to think short-term as well as long-term, that have direct impact on social care service users' outcomes. So you always have to keep in mind the whole purpose and aims of the funding program and coming back to that. And PPI is really important, so it's effective, it's not lip service, they are really embedded throughout the process. And the collaboration with the organization is really important, because that's what would make your project impactful, that you're engaging with the right stakeholder from the very beginning throughout your project, and that, local authorities, care providers, associations, etc. And when you develop the application, you might have an idea for a while. So maybe the process to start was connect with relevant researchers, discuss and reflect, seek advice. So RDS are really good. And I think during earlier in my career, there was nothing like that. So we are really fortunate at that stage of, kind of life, that we've got RDS advisors happy to support and also to seek advice from service users and carers in a full way. So run the ideas with them and see, do they get it? Is it important? If it's not important, why? Maybe you need to think about something else. And application guidelines, it's an obvious thing, but it's really important to read the guidelines and follow them. And frame the idea bearing in mind the call specification. So essential elements to include and connect them well. Do the research question follow logically from the identified problem? Are the methods suitable to the proposed question and objectives? And make clear connections to outcomes. Then, okay, you've done this research, how it's going to be connected to the outcomes? What will your project produce? How are you going to build upon it further? What are the short and term long benefits? And language, please. Language, I think, is really important to explain terminologies and, give it to your, any 14 years old or 15 years old and ask them to read. Have they got anything out of it? Use diagrams if especially on the second stage. The first stage, there's not much space to do that, but diagrams very helpful in summarizing ideas and connecting different elements of your project together.